A young girl was acting strangely nervous around her dad in the clinic's waiting area, and when the doctor took an X-ray, what he saw made him call 911 immediately. It was a quiet evening at El Camino Community Health Clinic, a small, modest clinic located 15 miles from the US-Mexico border in a dusty town with high traffic of migrants and transients. Faded beige walls and outdated medical posters gave the clinic a weathered appearance that matched its surroundings. The fluorescent lights buzzed overhead, casting a harsh glow across the worn linoleum floors. The clinic was understaffed, with only a limited number of doctors and a few nurses on duty during late shifts. It was 9 p.m., and Dr. Rafael Mendez, an internist with 12 years of experience in border healthcare, had just finished with a patient. He walked the elderly woman toward the door, providing final instructions about her medication regimen. His nurse assistant, Carla Soto, helped the elderly woman toward the pharmacy section. Nurse Carla was efficient and observant, qualities that made her invaluable in this understaffed clinic. She had worked alongside Dr. Rafael for 3 years, and they had developed an unspoken understanding and rhythm to their work. Dr. Rafael glanced at the waiting room to check how many patients he had next. He saw only a father-daughter pair who looked like immigrants. The father, a man in his early 40s with a weathered face and calloused hands, was holding a newspaper. His eyes darted nervously around the room, never settling in one place for too long. The girl, who appeared to be around 12 years old, sat quietly beside him, but in a rather defensive posture, hunched over slightly with her arms wrapped around her midsection, her face occasionally contorted in a grimace, as if she was in pain. She wore a simple pink t-shirt and matching pants that hung loosely on her small frame. Dr. Rafael went back to the examination room without greeting the patients yet, waiting for his nurse to confirm their administration. He sat behind his computer desk to finish some paperwork, the report of the previous patient, and waited for his nurse assistant. Through the thin walls, he could hear the muffled sounds of the clinic, phones ringing at the front desk, the hum of the air conditioning system struggling against the desert heat, and the occasional cough from the waiting area. When Nurse Carla arrived, she immediately informed him of his new patient while sanitizing the room, bed, and equipment. Her movements were practiced as she sprayed disinfectant and wiped down surfaces. "Dr. Mendez," she said quietly, leaning closer so her voice wouldn't carry beyond the room, "I think there's something off about the new walk-in pair." She glanced toward the door before continuing. "They're new patients here, haven't been to this clinic before, they have no IDs." She continued wiping down the examination table as she spoke. "The father seems overprotective of the daughter, barely lets her speak, and the daughter—" Nurse Carla paused, her brow furrowing. "She looks like she's in pain. When I offered her water earlier, the father sternly refused, speaking for her. It was, strange." Nurse Carla disposed of the used wipes and turned to face Dr. Rafael. "Do you still want to accept this patient? We could refer them elsewhere if you're concerned." Dr. Rafael considered this for a moment. He had grown up in the area and had experience in border health emergencies. He understood the dark realities around the border, but still tried to make a difference, one patient at a time. "We have no other patients right now, and my shift doesn't end for 3 hours, he said, running a hand through his thick black hair as he eyed the clock on the wall and noted there were still a few hours until the end of his shift, which ended at 11:45 p.m. "Besides, the patient is a child and she's obviously in pain. I can't turn her away." Something in his gut told him this girl needed help, and as a doctor, he couldn't ignore that. He had seen too many cases of abuse and exploitation in this border town, and the thought of turning away someone in need went against everything he believed in. Nurse Carla nodded in understanding. She finished her sanitation task and went to the door. She called the patient in, and from the gap, "Doctor." Rafael saw how the father seemed overbearing, not letting the girl out of his sight. He constantly clutched the girl's wrist and whispered to her, while the girl kept glancing at the exit sign of the clinic, her eyes wide with what appeared to be fear. The father-daughter pair entered the room, the man's grip on the girl's wrist visibly tightening as they crossed the threshold. Nurse Carla greeted them with a professional smile, that didn't quite reach her eyes. "Good evening," she said, gesturing to the examination space. "I'll need to take your daughter's vitals first before Dr. Mendez examines her." The father, a stocky man with dark, wary eyes, spoke before the girl could respond. "She has a simple stomach bug," he said gruffly, his accent thick. "She just needs something to settle it. Nothing complicated." The girl, Lucia, stood silently beside him. She looked pale, almost ashen, with a thin sheen of sweat on her forehead. Her eyes were downcast, deliberately avoiding eye contact with both the nurse and doctor. Her small hands trembled slightly as they rested at her sides. Nurse Carla maintained her professional demeanor. "I understand, sir, but we still need to follow procedure. All patients require a basic vital check before seeing the doctor." The father looked as though he might object further, but then gave a curt nod, releasing the girl's wrist reluctantly. Nurse Carla gestured for Lucia to sit on a chair near the vital monitoring equipment. "Lucia, I'm going to check your blood pressure, oxygen levels and weight, okay?" The girl nodded almost imperceptibly and sat down. As Nurse Carla wrapped the blood pressure cuff around her thin arm, Dr. Raphael noticed how the girl winced slightly at the pressure. Miguel stood nearby, watching every move with hawk-like intensity. After completing the measurements, Nurse Carla noted down the numbers and delivered the chart to Dr. Raphael. He studied the details quietly, noting that the girl's blood pressure was slightly elevated, likely from stress, and her oxygen saturation was at the lower end of the normal range. Most concerning was her weight, which fell below the 15th percentile for her age. "Lucia," Dr. Raphael said gently, "I'd like to examine you in the exam space. It will just take a few minutes." Miguel immediately stepped forward. "I'm coming with my daughter." Dr. Raphael maintained a calm, professional tone. "Mr. Alvarez, you're welcome to stay in the room, but I need to examine Lucia privately. You can sit right here and wait." He gestured to a chair just a few feet away from the examination area. Miguel's jaw tightened, and for a moment Dr. Raphael thought he might refuse. Finally, with obvious reluctance, Miguel nodded and sat down, his eyes never leaving his daughter. Lucia hesitantly followed Dr. Raphael to the examination bed and climbed up with visible discomfort. Dr. Raphael drew the privacy curtain, creating a thin barrier between them and Miguel, though they could still see his silhouette through the fabric. "Lie down, please, Lucia," Dr. Raphael instructed softly. "I need to examine your abdomen." The girl complied silently, her eyes wide with apprehension. Dr. Raphael gently lifted just enough of her shirt to expose her abdomen. He noted immediately that her skin appeared taut across her stomach, with slight distension in the upper quadrants. As he began the basic abdominal palpation, Lucia winced and flinched in pain. Her stomach felt rigid in certain areas, abnormally so for a simple stomach bug. When he pressed gently on the right upper quadrant, she bit her lip to stifle a cry. "Does it hurt here?" he asked, pressing lightly near her liver. "Yes," she whispered, her voice barely audible. "Do you feel bloated, Lucia?" Another whispered, "Yes. How's your appetite? Have you been eating normally?" She shook her head slightly. "What was the last thing you ate and when?" "Water. Just water yesterday," she murmured, glancing nervously toward the curtain as if afraid her father might hear. Dr. Raphael maintained a neutral expression despite his growing concern. The girl's behavior was alarming, but not entirely surprising. He had seen countless young children who were overly controlled by adults in this area. Near the border, it was a dangerous place to live, and many parents, especially immigrant parents, were strict out of necessity and fear. However, the abdominal rigidity concerned him greatly. Parts of her stomach were harder than others, suggesting a potential obstruction or foreign bodies. He kept his expression neutral and professional as he completed the examination, then opened the curtain again. Miguel immediately stood up, his posture tense. "Well, it's just a stomach bug, right? Give us some medicine so we can go." Dr. Raphael exchanged a quick glance with Nurse Carla before addressing Miguel. "Mr. Alvarez, I found some abnormal abdominal rigidity and unexplained pain. I need to order an X-ray just to be safe." Miguel's face darkened. X-ray? We don't need anything fancy like that. Just give us some medicine. I can't do that, Dr. Raphael said firmly. I can't prescribe medication without knowing the source of the pain. X-rays are routinely used to detect abnormalities inside the digestive tract. He paused, then added, Additionally, Lucia appears dehydrated. Look at how she's perspiring despite the cool room temperature, and her severely chapped lips. He gestured to Nurse Carla. Could you bring Lucia a cup of water, please? Before Nurse Carla could move, Miguel cut in. Fine, do the X-ray, whatever, just do it quickly. When Nurse Carla returned with water, she offered it to Lucia. The girl glanced quickly at her father, then refused in a whisper, avoiding eye contact. Dr. Raphael handed Miguel some paperwork detailing the X-ray procedure. Please take this to the radiology section. Nurse Carla will show you the way. Come back to see me after the X-ray is completed. He noticed Lucia had difficulty walking, slouching and holding her stomach in obvious pain. Carla, let's get Lucia a wheelchair. The nurse quickly retrieved one, and Lucia sat down with relief evident on her face. As Nurse Carla began to push the wheelchair out of the room, Dr. Raphael watched Miguel's tense posture and the way his eyes darted nervously around the clinic. Something was very wrong here, and the X-ray would hopefully reveal what it was. Dr. Raphael checked if he had another patient to take while waiting for the X-ray result, but the waiting room was empty. The small clinic was quiet at this hour, with only the occasional sound of the air conditioning system cycling on and off breaking the silence. Feeling uneasy about the Alvarez case, he left his examination room and walked down the corridor to the radiology section. The clinic's radiology department was modest, just one room with basic equipment that could handle common diagnostic imaging needs. As he approached, he saw Miguel waiting outside the room, pacing nervously while speaking on his phone in hushed Spanish. The man's face was tense, his free hand clenched into a fist at his side. When Miguel spotted Dr. Raphael, he quickly ended his call, his expression hardening into a cold, stern mask. Dr. Raphael nodded politely toward him. Mr. Alvarez, it's safer to do phone calls a distance away from the door, he said, pointing further down the corridor. The equipment can sometimes be affected by cellular signals. Miguel narrowed his eyes but moved away as instructed, still watching Dr. Raphael intently. Dr. Raphael entered the radiology room, where a technician named Marco was preparing Lucia for the scan. The girl lay still on the table, her face pale and drawn with pain. Marco looked up as Dr. Raphael entered. Just about to start, doctor, he said. Dr. Raphael nodded and stepped back as Marco positioned the equipment. Lucia, I need you to stay completely still for a moment, Marco instructed through the microphone. The girl nodded slightly, her eyes wide with fear. The machine hummed to life, capturing the internal image of Lucia's abdomen. As they waited for the image to process, Dr. Raphael thought he heard a whisper from the table. Please, don't take me. The words were so soft, almost indistinguishable over the whirring of the X-ray machine. Marco glanced at Dr. Raphael, his brow furrowed in confusion. He wasn't sure what the girl meant, and her voice was too low to clearly make out the words against the background noise. Lucia, we need to stay very still, Marco said into the microphone again. We'll need to retake the image. After the second attempt, the digital image appeared on the computer screen. Both Dr. Raphael and Marco leaned forward, their expressions changing from professional neutrality to shock. The X-ray revealed dozens of oval, dense shapes throughout Lucia's gastrointestinal tract. The foreign bodies were uniform in size and density, clearly not natural to her anatomy. Dr. Raphael immediately recognized what they were seeing: drug pellets. Someone had forced this child to swallow packages of drugs for smuggling. Marco, send the digital copy to my computer immediately, Dr. Raphael said urgently, his voice low. Marco nodded, his face grim as he transferred the files. Dr. Raphael exited the room, passing Miguel, who was still on his phone, now speaking more urgently in Spanish. Their eyes met briefly, and Dr. Raphael forced himself to maintain a neutral expression despite the rage and disgust building inside him. He returned quickly to his office and checked his email for the X-ray files. Opening them on his screen, he examined the images in detail. There were at least 3 dozen drug pellets visible throughout Lucia's digestive tract. Most concerning was that one of the pellets appeared to be leaking, explaining the girl's pain and the danger she was in. If that package had ruptured, she could be experiencing a potentially fatal overdose. Dr. Raphael searched online medical databases, confirming what he already suspected. The images matched documented cases of body packing, the practice of swallowing sealed packages of illegal drugs for smuggling. Most cases involved adults, but there were horrifying instances of children being used as drug mules because they attracted less suspicion from authorities. Leaning back in his chair, Dr. Raphael pinched the bridge of his nose, feeling a wave of anger and helplessness. Lucia was being exploited, her life endangered for drug trafficking. He thought how Miguel was probably not her father, but a handler using her to smuggle drugs across the border. He glanced through the small window in his office door and noticed that Miguel and Lucia had not yet returned from radiology. This was his chance. He picked up the phone and dialed 911, keeping his voice low and urgent. "This is Dr. Rafael Mendez at El Camino Community Health Clinic. I have a child patient who has been forced to ingest multiple drug packages for smuggling. One package appears to be leaking. I need police and medical transport immediately. The handler is still in the building." He provided a description of Miguel and Lucia, emphasizing the immediate danger to the child's life if the leaking drug package fully ruptured. "Please hurry," he added. "I believe they may attempt to leave once they realize I've discovered the drugs." As he hung up the phone, Dr. Raphael steeled himself for what would come next. The most important thing was keeping Lucia safe and getting her the emergency medical care she needed before the leaking drug package claimed her life. "After the phone call, Doctor." Raphael walked out of his office and into the corridor, intending to check if Miguel and Lucia had returned from radiology. He was surprised to see that another patient, an elderly man with a cane, had arrived in the waiting room. The clinic's night receptionist was helping him fill out forms, but Dr. Raphael knew he needed to handle the urgent situation with Lucia first. He approached the patient administration desk near the nurse station to inform them of the situation. Several nurses, sensing something was wrong, began to gather as he spoke in hushed tones. "I've called 911, he explained to the head nurse. "We have a child who's been forced to swallow drug packages. One appears to be leaking. Police are on their way, but we need to be careful not to alarm the handler." The nurses exchanged concerned glances, their expressions a mixture of shock and determination. Just as Dr. Raphael was explaining the need for emergency medical intervention, he noticed movement from the corner of his eye. Miguel and Lucia were walking past the administration desk, escorted by Nurse Carla. Miguel's eyes narrowed as he observed the group of staff members huddled in serious conversation, their concerned faces turned toward him. Lucia, looking even paler than before, kept her gaze fixed on the floor. Nurse Carla, unaware of what Dr. Raphael had discovered, smiled politely. "The X-ray is complete. I told them to wait in the waiting area while the images are reviewed." Dr. Raphael nodded, trying to appear casual. "Thank you, Carla. I'll be with them shortly." As Nurse Carla led Miguel and Lucia toward the waiting area, Dr. Raphael quickly pulled her aside and whispered the situation. Her eyes widened in shock, and she couldn't entirely suppress her reaction when she glanced back at Miguel. It was enough. Miguel, already suspicious, noticed the exchange. His posture changed instantly, from tense to alert, his eyes darting between Dr. Raphael, the nurses, and the clinic exits. In one swift motion, Miguel grabbed Lucia's arm roughly and pulled her toward the side exit door. The elderly patient in the waiting room shouted in alarm, "Hey! What are you doing to that child?" "Stop them!" Dr. Raphael called out, running after them. 2 male nurses joined the pursuit, but Miguel was surprisingly fast. He shoved through the side door, practically dragging Lucia, who stumbled and cried out in pain. By the time Dr. Raphael and the nurses reached the parking lot, Miguel had forced Lucia into a waiting car, that immediately screeched away, tires spinning on the gravel. "Did anyone get the license plate?" Dr. Raphael asked desperately, but no one had been able to see it clearly in the dim parking lot lighting. 5 minutes later, police cruisers pulled into the clinic parking lot, lights flashing. Officer Roja Cruz, a veteran Border Patrol officer who had seen too many similar cases, took Dr. Raphael's statement with a grim expression. "We'll put out an alert," Officer Cruz said, examining the X-ray Dr. Raphael had printed. "But without ID or a clear photo, it's going to be difficult." "That girl is in immediate danger," Dr. Raphael insisted, pointing to the X-ray. "One of the pellets has ruptured. She's likely overdosing as a higher dosage of drugs enters her system. She needs emergency care now." Officer Cruz's expression darkened. "Doctor, I understand your concern, but you need to understand what we're dealing with. These children are disposable couriers. The cartels use them because even if they're caught, they face minimal consequences as minors. And if something goes wrong..." She didn't finish the sentence. "So we just give up?" Dr. Raphael asked incredulously. "Our resources are stretched too thin," Cruz explained. "No ID, no name. It's essentially a dead end. We'll alert border checkpoints with the description, but these people know how to disappear." Dr. Raphael felt a surge of frustration. "This hospital stands on dangerous ground near the border, but that doesn't mean we're supposed to give up on kids," he said sharply. He provided detailed descriptions of Miguel and Lucia, their height, weight, clothing, eye color, hair color, anything that might help identify them. "Any distinguishing features?" Officer Cruz asked. "Scars, tattoos, birthmarks?" Dr. Raphael and Nurse Carla looked at each other and shook their heads. "Nothing obvious," Nurse Carla replied. Officer Cruz sighed. "We'll try. But doctor, you should know, these cases happen daily around the border. Children being used as drug mules, human trafficking victims. We have limited resources, and we can't save everyone." Dr. Raphael watched helplessly as the police team left the clinic. The harsh reality of border healthcare weighed heavily on him. Most likely, Lucia would never receive the medical care she desperately needed. The thought of her suffering, possibly dying from a drug overdose because she'd been exploited by traffickers, filled him with a cold rage. He and Nurse Carla returned to the examination room in silence, where the elderly patient was still waiting. They had no choice but to continue with their work, though the image of Lucia's frightened face stayed with Dr. Raphael as he forced himself to focus on his next patient. The next hour passed as normally as possible under the circumstances. Dr. Raphael attended to the elderly man with a kidney infection, prescribed antibiotics, and then saw 2 more walk-in patients with minor ailments. But his mind kept returning to Lucia and the X-ray showing dozens of drug pellets in her small body. At 11:45 p.m., the clinic closed for the night. The nurses filed out, bidding goodnight to Dr. Raphael. Nurse Carla lingered for a moment, placing a sympathetic hand on his shoulder. "You did everything you could," she said quietly. "Try not to blame yourself." Dr. Raphael nodded, though the reassurance did little to ease his conscience. "Good night, Carla. Drive safely." After everyone had left, Dr. Raphael stayed behind to finish paperwork and review medical literature on body packing cases. He found numerous case studies of drug couriers suffering from toxicity when packages ruptured, the mortality rates disturbingly high even for adults. For a child Lucia's size, the prognosis would be even worse. 15 minutes passed as he read through the grim statistics. Finally, with a heavy sigh, he decided it was time to go home. He gathered his belongings, switched off the lights, and locked the doors behind him. The parking lot was nearly empty now, his car sitting alone under a flickering lamppost. As Dr. Raphael approached his vehicle, the hair on the back of his neck stood up. Something felt wrong. He quickened his pace slightly, reaching for his keys. Suddenly, from behind, someone approached in a quick stride. Before Dr. Raphael could turn, he felt the cold metal of a gun barrel press against his back. "Don't move," a familiar voice growled. "Examine my daughter and help her." Miguel. Dr. Raphael raised his hands slowly and dropped his work bag on the asphalt. "If you shout, I'll shoot immediately," Miguel warned, his finger visibly on the trigger when Dr. Raphael glanced back. "I've already pulled the trigger halfway." "Where is she?" Dr. Raphael asked, his medical training immediately overriding his fear. "By the clinic side door. Slowly turn back toward the clinic and walk. No sudden movements." With his hands still raised, Dr. Raphael walked carefully back toward the clinic. As they rounded the corner to the side entrance, he saw Lucia lying motionless on the ground. Her condition had deteriorated dramatically in the hours since they'd fled. Her skin had a bluish tinge, and a small amount of foam had gathered at the corners of her mouth. She was barely conscious, her breathing shallow and irregular. "Fix her," Miguel demanded, the gun still trained on Dr. Raphael. "I will," Dr. Raphael replied, his doctor's instincts taking over. "But I need you to lower the gun. I can't help her with you pointing that at me." Miguel's hand trembled slightly. "How do I know you won't call the police again?" "One of those pellets in her body has ruptured, and your daughter is overdosing because the drugs are in her system," Dr. Raphael explained calmly, though his heart was racing. "Every minute counts now. You can keep the gun, but please let me work. You don't want to regret this." After a moment's hesitation, Miguel lowered the weapon but kept it in his hand. "Save her," he said, and for the first time, Dr. Raphael heard genuine fear in the man's voice. Dr. Raphael quickly unlocked the clinic door with his keycard and carefully lifted Lucia in his arms. Her body felt frighteningly light as he carried her inside. He brought her to the emergency treatment room and gently laid her on the bed. Working swiftly, he gathered supplies for emergency gastric decontamination. He started an IV line to address her dehydration and prepared for a bowel irrigation to flush the toxic substances from her system. The girl was semi-conscious, occasionally moaning in pain. "I need to sedate her lightly for this procedure," Dr. Raphael explained as he worked. "It will make her more comfortable and allow me to work more efficiently." Miguel hovered nearby, the gun now tucked into his belt, but still visible as a threat. After administering a mild sedative, Dr. Raphael began the irrigation process, watching Lucia's vital signs carefully on the monitor he'd hooked up. "This will help flush her system temporarily," he explained to Miguel, "but she needs surgery to remove the other packages. There are too many inside her, and they could rupture at any time. I have no equipment here to perform that kind of surgery." Miguel's face hardened. "No hospital." "She will die without proper surgical intervention," Dr. Raphael insisted. "I need to call EMS for transport. She needs a surgical team." Miguel pulled the gun out again. "No hospital." "Fix her here." Dr. Raphael fought to remain calm. "I can't, not here. There are no tools for this kind of procedure, and your daughter will die." He paused, then added, "But I have a friend who's a veterinarian. He has a clinic nearby with surgical equipment." Miguel's eyes narrowed suspiciously. "A vet? You want to take my daughter to an animal doctor?" "He has the tools I need for this procedure," Dr. Raphael insisted. "It's her only chance." Miguel seemed to waver, watching as Lucia coughed and more foam appeared at her lips. Finally, he nodded curtly. "Fine. But if this is a trick—" "It's not," Dr. Raphael assured him. "I need to make a phone call to my friend. You can watch your daughter while I do that." "I'm coming with you," Miguel insisted. Dr. Raphael shook his head. "You need to trust me if this is going to work. Stay with her. Monitor her breathing. Call me immediately if anything changes." After a tense moment, Miguel reluctantly agreed, choosing to stay with his daughter. Dr. Raphael left the room and hurried to the administration desk. Instead of calling his veterinarian friend, he dialed for an ambulance. "This is Dr. Rafael Mendez at El Camino Clinic. I need an emergency transport for a pediatric patient with a ruptured—" He was about to give more details and request police backup using a code word for a hostage situation when he felt the cold metal of the gun barrel against the back of his head again. Miguel had followed him after all. "Cancel the call," Miguel said, his voice deadly quiet as he released the safety on the gun with an audible click. Dr. Raphael's heart sank as he spoke into the phone. "I'm sorry, this was a mistake. Cancel the request." He hung up, knowing he had just lost his best chance to save both Lucia and himself. Miguel marched Dr. Rafael back to the hospital room where Lucia lay, still unconscious from the sedation, but breathing more regularly now thanks to the emergency treatment. The irrigation procedure had temporarily helped stabilize her, but Dr. Rafael knew it was only buying time. "Sit down," Miguel ordered, gesturing to a chair with his gun. Dr. Rafael complied, watching as Miguel tied his hands behind his back with a length of bandage he tore from a nearby supply shelf. Once Dr. Rafael was secured, Miguel stepped away, keeping the gun pointed in his direction, while he pulled out his phone and made a call. He spoke rapidly in Spanish, his tone urgent and occasionally pleading. Dr. Rafael, who understood Spanish fluently, listened carefully to Miguel's side of the conversation. "Yes, complications, the package broke. She needs help. No, a doctor discovered it. Yes, I have him. El Camino Clinic. 20 minutes? We'll be waiting." After ending the call, Miguel turned to Dr. Rafael, his expression dark. "You've made things very bad for both of us." "What do you mean?" Dr. Rafael asked, testing the restraints subtly. "I've called for transport. They'll take us to the facility. Someone there will operate on my daughter. They won't be kind to either one of us, Doctor." Rafael felt a chill run through him. "Why not take her directly to your facility in the first place? Why come here?" Miguel's jaw tightened. "That's the thing, you've disappointed me and I'll deal with you later." He paced nervously, glancing at Lucia. "Those men shouldn't know that my daughter failed to deliver the packages. If they knew she's incapable of being a body packer, they would just kill her." He stopped pacing and looked directly at Dr. Rafael, his expression a mixture of anger and fear. "She means nothing to them, but she means everything to me. Because of you and your incompetence, they will know and they will kill her, and they will probably kill you too." Dr. Rafael felt confusion mingling with his fear. "If you love her, why let her do this? Why put her life at risk?" Miguel maintained his stern, dangerous expression, clearly trying not to appear weak with his gun still trained on the doctor. "I don't need to explain my life to you." Despite Miguel's attempt to remain the intimidating captor, Dr. Rafael sensed there was more to the story. It seemed that Miguel was also being forced to work for the higher-ups in this drug operation, using his own daughter as a mule. Their conversation was interrupted by the sound of a vehicle pulling into the parking lot. Miguel tensed, quickly checking through the window blinds. "They're here," he said. "Don't try anything stupid." Miguel checked the corridor, then returned to untie Dr. Rafael, keeping the gun pressed to his ribs. "Walk slowly. Say nothing." 4 men in black masks and tactical clothing entered through the side door, moving with practiced efficiency. 2 immediately went to Lucia, disconnecting her from the monitoring equipment and carefully transferring her to a stretcher they'd brought. From their movements, Dr. Rafael could tell they had medical training. They checked her airway and secured her properly before loading her onto the stretcher. As they wheeled Lucia toward the exit, a large, muscular man approached Dr. Rafael and Miguel. Without speaking, he roughly grabbed Dr. Rafael's arm and led him outside to where 2 vehicles waited, a van where they were loading Lucia and a black SUV with tinted windows. "Get in," the man ordered, shoving Dr. Rafael toward the SUV. As he climbed in, Miguel followed, still holding his gun. The large man handed Miguel a burlap sack. "For him," he said, nodding toward Dr. Rafael. Miguel pulled the sack over Dr. Rafael's head, plunging him into darkness as the vehicle began to move. Through the rough fabric, Dr. Rafael could hear the engine roar as they accelerated away from the clinic and into the unknown. The next moment, Dr. Rafael saw light was when the sack was pulled off his head. He blinked rapidly, his eyes adjusting to the sudden brightness. He found himself sitting in a room that looked like the inside of a warehouse, tied securely to a metal chair in the corner. His surroundings came into focus gradually, concrete floors, metal walls, and harsh overhead lighting that gave everything a clinical, bluish tint. At the center of the room was a surgical table equipped with modern medical instruments. 3 people in black scrubs and medical masks moved around it efficiently, concealing their faces completely. They wore gloves and worked in an eerie silence, communicating only through practiced gestures and nods. On the table lay Lucia, now unconscious, likely from administered anesthesia. A monitor nearby displayed a real-time internal view of the operation. Dr. Raphael, with his medical training, could see they were performing a gastric extraction of the drug pellets. The lead surgeon worked with remarkable skill, making precise incisions and carefully removing the oval packages one by one. No one spoke a word, not even the standard surgical procedure announcements that would be mandatory in a legitimate operating room. The perfect coordination of the team suggested they had performed this procedure many times before. This wasn't their first extraction, and Lucia wasn't their first victim. Dr. Raphael turned his head and noticed two large windows on one side of the room. Through the glass, he could see two men watching the procedure. One was Miguel, his face a mask of tension as he observed his daughter's surgery. The other was an older man in an expensive suit, smoking a cigar despite the medical setting, his face impassive as he watched the operation like someone monitoring a business transaction. After what seemed like hours but was likely only 45 minutes, the team completed the extraction. All the drug packages had been removed from Lucia's system, and the surgical wound was closed with practiced efficiency. The team moved her to a stretcher and wheeled her out of the surgery room, leaving Dr. Raphael alone with his thoughts. Moments later, one of the nurses returned. Without speaking, she untied him and pointed to a door at the side of the room. "Clean up," she finally said, her voice muffled by the mask. "Shower room. Change into this." She handed him a set of black surgical scrubs, identical to what the team had been wearing. "What are you going to do with me?" Raphael asked, rubbing his wrists where the ropes had cut into them. The nurse didn't answer, but the tension in her posture was clear. Before she could leave, the door opened, and one of the men who had been watching from outside entered. He was tall, with a shaved head and a scar running from his left eye to his jawline. "You're too deeply involved and you are a doctor," he said, his voice surprisingly refined for his intimidating appearance. "You have two options." He walked slowly around Dr. Raphael, assessing him with cold calculation. "Option 1. Get yourself cleaned up, put on the robe, and follow whatever we tell you to do." He paused. "We checked your profile before bringing you here. You were once a surgeon before settling as an internist. We can make good use of those skills." Dr. Raphael's stomach churned at the implication. "And option 2? "Refuse and we'll have to end your life as a doctor," the man replied simply. "I'll never work for you," Raphael said firmly. "I'd rather die." The man chuckled. "Who said anything about dying?" At that moment, the door opened again and another man entered, roughly pushing a boy of about 10 years old. The child's eyes were wide with terror, his small body trembling. "Option 1, the scarred man continued. "You and the lead surgeon will move those packages that were removed from Lucia's body into this boy's digestive tract." He gestured toward the packages that had been placed in a sterile container nearby. "Option 2, we move those packages into your body, and you'll work for us as a mule." His smile turned cruel. "Don't underestimate how we could manage to subdue people. Not only children work for us, but adults too. Some of our best couriers are professionals like yourself, people with clean records who attract minimal suspicion." Dr. Raphael stared at the frightened boy, feeling sick with horror. He couldn't possibly operate on a child to insert drug packages. It went against everything he had sworn to uphold as a doctor. But becoming a drug mule himself would mean almost certain death if the packages ruptured. He glanced around desperately. There were no windows except for the observation ones, no visible exits except the heavily guarded door. He had no belongings, no phone to call for help, and no idea where he was. "You should clean yourself up and put on the robe regardless of which side of the table you end up on," the scarred man said with a smirk. "You have 5 minutes to decide." Raphael took the black medical robe and followed the nurse to the change room. As he passed the terrified boy, their eyes met briefly. The pure fear he saw there solidified his resolve. He could never be part of this operation. The change room was small, with a basic shower stall, sink and bench. After the door closed behind him, Raphael leaned against the wall, his mind racing. This wasn't a normal situation, and he needed to think beyond his medical training. He washed his hands and face, changed into the black scrubs, and made his decision. Whatever happened next, he would not become complicit in their operation. He would find a way to save that boy, Lucia, and himself, or die trying. Dr. Raphael emerged from the dimly lit change room, dressed in the black scrubs. The same nurse was waiting for him, her eyes betraying anxiety despite her mask. She led him back to the operating room, where the lead surgeon, still masked, was preparing instruments for the next procedure. "I've decided to learn from you," Raphael told the surgeon, forcing confidence into his voice. "Show me how you do this." The lead surgeon nodded approvingly. "You made the right choice. You won't regret working for these men. They pay well, 3 times better than any hospital." He arranged surgical tools on a metal tray as he spoke. "Just don't make them feel like you're a liability. Do your job, keep your mouth shut, and you'll be fine." Meanwhile, 2 assistants had brought the terrified boy to the table and begun to sedate him. As they waited for the anesthesia to take effect, Raphael found the courage to ask a question. "What happened to the girl from earlier? Lucia?" The surgeon glanced up from his preparations. "Why do you care?" "Professional curiosity," Raphael replied with a shrug. "I treated her initially." The surgeon continued arranging his tools. They usually just deconstruct those kinds of children when they've outlived their usefulness. Raphael's blood ran cold. "Deconstruct? What does that mean?" The surgeon made a vague gesture with his gloved hand. "Organ trafficking. Good buyers for young, healthy organs. Everything gets utilized. Nothing goes to waste in this operation." Fighting to maintain his composure, Raphael watched as the surgeon signaled to the observation window, where the 2 men were still watching. A simple hand gesture. They were ready to begin. The scarred man nodded in response. The door opened and Miguel stepped in, approaching Raphael with a blank expression. He took Raphael by the arm and led him back to the chair in the corner, but positioned it closer to the operating table this time. Miguel secured Raphael's hands behind his back, though Raphael noticed the restraint wasn't as tight as before. "First time you should just watch from a distance," the lead surgeon explained. "We don't automatically trust new people." As Miguel finished securing him, Raphael noticed the profound grief in the man's eyes, despite his attempt to maintain a flat, emotionless expression. He must be devastated about Lucia, Raphael realized, remembering Miguel's earlier words about how much his daughter meant to him. Just as Miguel was about to step away, Raphael felt something cold and metal being pressed into his palm. Miguel leaned close, his lips nearly touching Raphael's ear. "Save my daughter. Far corridor to left. Use the key." He whispered quickly, his voice barely audible. Raphael's fingers closed around what he now realized was a single key. The knot binding his wrists was loose enough that he could work his hands free with some effort. Not the professional restraint a kidnapper would use, but something deliberately easy to escape from. Miguel straightened up and walked away, joining the scarred man as they exited the room. The surgeon began the procedure, lifting the unconscious boy's hospital gown and disinfecting his abdomen with practiced movements. Raphael waited until everyone was focused on the beginning of the surgery. The nurse had her back to him, preparing more equipment, and the surgeon was making the first incision. Slowly, carefully, Raphael worked at the loose knot, freeing his hands while keeping them behind his back to maintain the appearance of being restrained. "I'm sorry," he whispered, too quietly for anyone to hear, a silent apology to the boy he couldn't save at this moment. With the key clenched tightly in his hand, Raphael rose to his feet with calculated care. No one looked his way. Step by step, he backed toward the door, fingers brushing the handle. A quiet click echoed as he locked it. That was when the medical team took notice. Eyes widening, the nurse lunged toward the exit, but it was too late. The door held firm and the soundproof walls swallowed their shouts. Raphael knew he didn't have much time. Sooner or later someone would raise the alarm. Without hesitation, he slipped into the corridor and vanished from sight. The hallway was dimly lit and eerily quiet in what must have been the dead of night. Following Miguel's instructions, Raphael moved quickly to the end of the corridor and turned left, then continued to the furthest door on the left. He tried the handle. Locked. He used the key that Miguel must have slipped into his hand while securing him to the chair. The key worked. Raphael pushed the door open to find what appeared to be a small, shabby office. Miguel was inside, pacing nervously. He looked up with obvious relief when Raphael entered. "You made it," he said, quickly closing the door behind Raphael. "We need to move fast to save my daughter." "If you have weapons and know where she is, why didn't you do this yourself?" Raphael asked, suspicious despite the man's apparent help. "Why involve me? Why not just call the police?" Miguel's face darkened with shame. "I can't do this myself. These people are part of me, and I don't deserve to be a hero." He ran a hand through his hair, his composure cracking. "Still, I will help you save my daughter. You need to take her far, far away from here and promise to give her a new life. You're her only hope. Even I can't guarantee she would be safe outside." "What about you?" Raphael asked. "My life is here," Miguel replied, resignation heavy in his voice. "I am a drug smuggler and will always be. My father was, and so was my grandfather, and the people before them. There's no escape for me." He held out his hand for the small pistol. "Use this gun on me, take my belongings, call the police and save my daughter. They're keeping her in the room 3 doors down on the right. They plan to harvest her organs in a few hours." Raphael stared at the gun in his hand, then handed it back to Miguel. "I can't shoot you. Use it on yourself if you want to maintain your cover. But give me my phone back and the key to Lucia's room." Miguel nodded, handing over his phone, wallet and a key labeled 15. "When you hear the shot, run. They'll be distracted long enough for you to get to her." Raphael took the items and moved toward the door. "Thank you for helping your daughter. She deserves better than this life." "Better than me," Miguel said quietly. "Now go." Raphael slipped out of the room and moved swiftly down the corridor, counting the doors until he reached room 15. Behind him a gunshot rang out, followed by shouts of alarm. Taking advantage of the distraction, Raphael unlocked the door to Lucia's room and slipped inside, quickly locking it behind him. The girl lay unconscious on a single bed, her complexion pale but stable. Raphael immediately checked her vital signs with his finger, weak but present. He pulled out his phone and dialed 911. "This is Dr. Rafael Mendez," he said urgently when the operator answered. "I need immediate police assistance. I've been kidnapped along with a child who was being used as a drug mule. We're being held at—" He looked around for any identifying information, then spotted an address on a medical chart hanging by the door. He relayed the location to the operator, adding, "There are armed men and illegal surgeries taking place. The child needs immediate medical attention." "Stay on the line, Doctor. Mendez," the operator instructed. "Police are on their way." Raphael positioned himself between Lucia and the door, the phone still pressed to his ear, and waited for help to arrive. Within 15 minutes, the sound of multiple police sirens pierced the night. Blue and red lights flashed through the small window of the room, where Raphael had barricaded himself with Lucia. He could hear shouting and the heavy footfalls of tactical teams entering the building. Suddenly, there was a violent knock at the door. Raphael tensed, unsure if it was rescue or one of the criminals. "Who is it?" he called out, positioning himself protectively in front of Lucia's bed. "Dr. Mendez, this is the police. We're coming in." Before Raphael could respond, the door burst open. One of the masked men from earlier stood there, his face now exposed and contorted with rage. He raised his gun toward Raphael. "You," he snarled, "you brought them here?" The man fired, but his shot went wide, splintering the wall beside Raphael's head. Before he could fire again, police officers appeared behind him, their weapons drawn. "Drop your weapon, now!" one officer shouted. The man hesitated, then turned his gun toward the officers. The sound of gunfire erupted, and the man fell to the ground. Tactical officers rushed into the room, quickly assessing the situation. "Dr. Mendez?" one asked, approaching Raphael. "Yes," Raphael confirmed, his hands raised. "The girl needs medical attention. She's been used as a drug mule and just had surgery to remove packages from her system." More officers secured the room while paramedics were called in. As they prepared to move Lucia onto a stretcher, one of the officers addressed Raphael. "Sir, we need to get you both out of here. The building is secure, but we're still processing suspects." Raphael nodded, following the officers as they escorted him and Lucia's stretcher out of the building. As they walked through the corridors, Raphael realized this place wasn't a warehouse as he'd initially thought, but some kind of makeshift clinic where these people conducted their body-packing operations. It wasn't nearly as large as it had seemed in his fear-heightened state, just a small converted industrial building on the outskirts of town. Once outside, as medical teams gathered to transfer Lucia to a waiting ambulance, Raphael took in the scene. Police cars and tactical vehicles surrounded the building. Officers were leading handcuffed suspects to police vans, including the masked medical team who had been performing the illegal surgeries. With a sick feeling, Raphael saw another stretcher being loaded into a different ambulance. The medical team had loaded a small form, and Raphael knew it was the boy from earlier. He could only hope they would be able to save him. Then Raphael saw them, Miguel and the other accomplices, including the surgeon and the nurses dressed in black robes and masks, being escorted toward a waiting police car. As the officers pulled off their disguises, their full faces were revealed, and with them, their true identities. Raphael's eyes locked onto Miguel, whose arm was bleeding from what looked like a gunshot wound. It was precise, serious enough to be believable, but clearly placed to avoid any vital areas. Their eyes met across the parking lot. Miguel gave a faint nod, a silent gesture of acknowledgement and gratitude. In that moment, Raphael understood. Miguel had shot himself to make it look like Raphael had wounded him during an escape. A carefully staged act, one that would protect Raphael's secret and keep the others from suspecting he'd had help from inside. A police officer approached Raphael. "Dr. Mendez, we need to take you to the station for your statement. One of our officers will drive you." Raphael nodded, watching as Lucia was loaded into the ambulance. "Can I check on her condition first?" "Of course," the officer replied, leading him to the ambulance where paramedics were stabilizing Lucia for transport. "Will she be okay?" Raphael asked one of the paramedics. "She's stable for now," the paramedic replied. "The surgery was actually quite professional, despite the circumstances. She'll need monitoring at the hospital, but her prognosis is good." Relieved, Raphael followed the officer to a waiting police car. As they drove away from the scene, he looked back at the nondescript building that had housed such horrors, wondering how many other children had passed through its doors. At the police station, the flurry of activity continued as officers processed the suspects and evidence from the raid. Detective Maria Sandoval, a seasoned investigator with the Border Crimes Task Force, led Raphael to an interview room where she sat behind a desk, ready to take his statement. "Dr. Mendez," she began, "I understand you've been through a traumatic experience. Take your time as you tell me what happened." Raphael recounted everything, how Miguel and Lucia had first come to the clinic, the X-ray findings, their escape when he called the police, and Miguel's return later that night with a gun. "He forced me to help his daughter who was already overdosing," Raphael explained. "I used bowel irrigation to flush her system and tried to call EMS for hospital transport. I wanted to call the police too, but Miguel caught me and threatened me with his gun." He described how Miguel had called his associates, who took them to the warehouse clinic, and the horrors he witnessed there. When Detective Sandoval asked specifically about Miguel's role, Raphael hesitated. He could tell her that Miguel had secretly helped him, untied his restraints, given him the key, told him where to find Lucia, and essentially sacrificed himself so his daughter could be saved. But he remembered Miguel's words, "I don't deserve to be a hero." "Miguel Alvarez," Raphael said slowly, "kept shouting that I took his daughter." "Yes," Detective Sandoval confirmed. "He was quite adamant about it in the police car, said you shot him and kidnapped the girl." Raphael made his decision. "I shot him in self-defense," he said firmly. "When they took me to that place, I managed to get free. I was looking for a way out, saw an office and thought there might be a phone inside. Miguel was in there. We struggled and I turned his weapon against him when he tried to shoot me." He continued, describing how he found a key labeled 15 on Miguel's desk, located the room, and called the police. Detective Sandoval took detailed notes, occasionally asking for clarification. "And why were you so determined to save this particular girl?" she asked finally. "You put yourself at considerable risk." Rafael thought about Miguel's final request, to take Lucia far away and give her a new life. He looked directly at Detective Sandoval. "I'm a doctor," he said simply. "It's my moral duty to help those in need. I couldn't leave her after seeing what they did to her." Detective Sandoval studied him for a moment, then nodded. "One last question, Doctor. Mendez, would you like to see the girl in the hospital later? We'll need a follow-up statement from you, and our officers could drive you there." "Yes," Rafael replied without hesitation. "I'd like to make sure she's recovering." "I'll arrange it," Detective Sandoval promised. "And Dr. Mendez, we'll keep you updated on the case as it progresses. What you did tonight has given us valuable intelligence on one of the largest drug trafficking operations in the area." After several hours of additional questioning and legal proceedings, Rafael was finally ready to leave the police station. An officer approached him in the waiting area. "Dr. Mendez, before you go, I thought you might want to know. This rescue operation has led to significant intelligence about other warehouses where this group operates. The facility where we found you was just their medical operations center. We recovered nearly 1/2 ton of cocaine already packaged in pellets, ready for transport." The officer continued. "We're conducting raids on 3 other locations based on documents we found. This might be the breakthrough we've needed against the Alonso cartel." Rafael nodded, absorbing this information. "And the girl?" "Lucia." "She's stable," the officer confirmed. "She woke up about an hour ago. We can take you to see her now." As they walked toward the exit, Rafael glimpsed the holding cells. Miguel was being led by 2 officers to a cell at the far end of the corridor. Their eyes met briefly, and Miguel mouthed silently, "Thank you." The drive to the hospital was quiet. Rafael lost in thought about the events of the night and what would come next. At the hospital, he was escorted to the pediatric intensive care unit, where Lucia was recovering under police guard. The girl's face brightened with recognition when Rafael entered her room. He waited until the police officer stepped outside before approaching her bed. "How are you feeling?" he asked gently. "Better," she replied, her voice still weak. "Not hurting so much now." Rafael checked her chart hanging at the foot of the bed, noting her improved vital signs and the medications she was receiving. "The doctor here said I can have water now," Lucia said, a small smile appearing on her pale face. "I was so thirsty before." Rafael poured her a cup of water from the pitcher on her bedside table. As she sipped it, he sat down in the chair beside her bed. "Lucia," he said quietly, "I need to tell you something. Your father, he sacrificed himself to save you." Her dark eyes widened. "What do you mean? Is he—" "He's alive," Rafael assured her quickly. "But he helped me get you out of that place. He wanted you to be safe, to have a chance at a different life." Tears filled Lucia's eyes. "He wasn't always bad," she whispered. "But the men, they made him do things, made us do things." "I know," Rafael said softly. "He told me to take you far from here to make sure you're safe." Lucia looked down at her hands. "I have no one else," she said simply. "My mother died when I was little. There's just my father. And now—" Rafael made a decision then, fulfilling the promise he'd made to Miguel. "You won't be alone," he said. "I promised your father I would take care of you, and I will." "Really?" Hope flickered in her eyes. "Really?" he confirmed. "You're safe now, Lucia. You don't have to be afraid anymore." Lucia reached out hesitantly and took his hand. "Thank you," she whispered. As she drifted back to sleep, exhausted from her ordeal, Rafael remained by her side, reflecting on how this incident had changed everything he believed. Growing up near the border, he had seen the darkness that existed in these borderlands, the exploitation, the trafficking, the desperate measures people took to survive. But he had also witnessed surprising courage and sacrifice, even from someone like Miguel, a man who had put his own daughter at risk but ultimately chose to save her. Raphael looked at Lucia's sleeping face and made a silent vow. He would honor his promise to Miguel. He would protect this child and give her the chance at life that had nearly been stolen from her. It wouldn't be easy. There would be legal hurdles, psychological trauma to address, and a long healing process. But in this moment, watching over this girl who had been used as nothing more than a vessel for drugs, Raphael felt a renewed sense of purpose. As a doctor, he had sworn to do no harm and to heal the sick. Tonight, that oath had been tested in ways he could never have imagined. But through the darkness of this harrowing experience, he had found a clarity about what truly mattered, using his skills and his compassion to make a difference, one life at a time. And with Lucia he would start anew,